Hello, and welcome to Dr. B Talks About Pulsatile Tinnitus with me, Dr. John Burgoyne, a practicing otolaryngologist in Austin, Texas, with over 30 years experience in treating patients with ear, nose, and throat problems. So today we're going to talk about pulsatile tinnitus. And the first question is, well, what is pulsatile tinnitus? Well, tinnitus itself just means there's a noise in the ear. That's all it means. Tinnitus is a symptom. It's not a diagnosis. So pulsatile tinnitus is a noise in the ear that pulsates. So meaning this is like a whooshing sound that happens in time with the pulse. It's usually whoosh, 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 and it'll be in time with the pulse. That's what makes it pulsatile tinnitus. Usually, so the most common reason that we see is inflammation or swelling. Let me explain that a little bit. If you're hearing things and there's an area that's infected, what happens with inflammation is a lot more blood goes to the area. So if you have a lot more blood going to an area in the ear, then you're going to hear it much more easily. So that can cause pulsatile tinnitus. Another thing that can cause inflammation, this is meant to be the top of the jawbone here, inflammation in the jaw joint will cause more blood flow in and around the jaw joint, and that will cause you to hear the pulsatile tinnitus. So inflammation or infection will bring in extra blood and will cause pulsatile tinnitus. The next thing that can happen is ear canal or middle ear blockage. So if the outside world is blocking, that makes things on the inside sound louder. So if you block the outer ear, sometimes you will hear pulsatile tinnitus. That can be something like earwax, or it can be if the middle ear is full of fluid because of an infection. So infection can cause pulsatile tinnitus either because the hearing's blocked or because there's extra blood flow in the area, but that can cause it. I've had it sometimes a hair that's fallen in the ear canal and is pushing on the eardrum can cause pulsatile tinnitus. So those are the usual reasons. Usually inflammation or swelling, ear canal or middle ear blockage. But, and here's the big but, pulsatile tinnitus can be due to artery problems or brain aneurysms. Our carotid artery comes up and goes right past the inner ear. And if that artery, which takes the blood to your brain, has an aneurysm, which is a little outpouching, that can be something that you can hear. Or if there's a narrowness down in your neck, so that the blood has to whoosh through to get through that, that can cause a pulsatile tinnitus. The big veins taking blood out of the brain can have anomalies that can also cause pulsatile tinnitus. So these are the things that we have to worry about. We have to worry about problems with the arteries or the veins. So what should you do? Well, this is a case where you need to go see an ear, nose, and throat doctor. This is not one that anybody else can do much about, and you really need to be seen. If you come see me, I'd examine for outer ear blockage, infection, or inflammation, and see if any of that is going on. I'd also get a hearing test because, as I say, if the outside hearing is being blocked, that can make the inside sounds like the pulse louder. But unless I can get a really good reason by my exam and my hearing test for you to have pulsatile tinnitus that I can fix right away, you may end up needing to have either what's called a CT angiogram or an MR angiogram. And that's to check out all those vessels inside your head, in your neck, and to make sure you don't have one of those very important things that we were talking about. So pulsatile tinnitus, it's not that common, but when it happens, it's something you need to pay attention to. Regular tinnitus, a sound in your ear, it's not usually a big danger to ignore that for a while, but if you have pulsatile tinnitus, you should make an appointment with an ear, nose, and throat doctor right away. Remember, Dr. B Talks About is not the practice of medicine, okay? So you're not going to learn everything you need to know by listening to a YouTube video, even a great one like mine. If you're in the Austin area and you want to come see me, just look me up, John Burgoyne. You'll be able to find me and come see me. And as always, if you've enjoyed Dr. B Talks About Pulsatile Tinnitus, make sure and click the buttons below. Like, subscribe to the channel, share. And I hope to see you again, seeing one of our other videos at Dr. B Talks About. Thank you.